Well, welcome back. Well, prevention and intervention in mental health disorders has become a major topic, not only in schools, but also in the workforce.
We have UND Professor Thomasine Heitkamp and Assistant Professor Shonda Schrader here to talk a little bit this morning about behavioral health. So thank you so much for coming in today. We were talking in the break a little bit about some of the research that you guys have been doing. Can you talk a little bit about what you have been doing and how UND is playing a role in this?
Well, sure. I'll start. I guess the university has created a strategic plan, and within that strategic plan, they have 5 grand challenges. We both serve on the Rural Health and Communities Grand Challenge, and under that Grand Challenge, we have brought in a grant that is a collaborative effort across campus, multidisciplinary, and Thomasine is actually the director of that project, the Mental Health Technology Transfer Center.
And this is a project that we're working on that's funded by the Substance Abuse and Mental Health Services Administration. And the goal of what we're doing is really to encourage providers, work with providers of mental health services to use the best evidence in the work that they do to provide better outcomes. We work across the 6-state region and advance really science.
Can you talk a little bit about, during the break, you mentioned you guys did a study and you said that the stigma around mental health is not as pervasive as you thought. So explain more about what you did and what you found.
Sure. So we are working on a team, again, through our grand challenges, and it's myself, Thomasine Heitkamp, and then another colleague of ours, Chi Ming, in our Department of Economics. And together we pulled a survey of individuals throughout the state of North Dakota. We worked with several chambers of commerce, Fargo included, Grand Forks, many rural communities, and using a scale, we went to measure how much stigma is there toward individuals with mental illness.
Why did you decide to do this study itself?
Well, we believe that stigma affects people's access to treatment and particularly people's willingness to secure treatment and supports and prevention. So we thought, let's look at what impact stigma has. We also work with substance use disorder. We have an addiction technology transfer center. And in the field of substance use, we see a lot of stigma, a lot of judgment. And so as we moved into mental health, we thought, let's look at the role of stigma in mental health so we can guide some of our discussions and our trainings and our instruction at the university around a bigger picture analysis of stigma. We do a lot of work in behavioral health at UND. We have a lot of professions doing that work, and so that being a backdrop to how people approach treatment.
So that as you've discovered some ways, okay, there's not as much stigma here, so maybe now there's some new ways to get people to get more access to help?
Absolutely.
Yeah, we also looked at different demographic variables. So we wanted to see, do these individuals have a family member who has mental illness? Do these individuals have higher education? What gender are they? So we can really figure out which groups of individuals in our state hold higher stigma or less stigma, so we can really tailor our education efforts and reach out to those groups.
What's the next step? Where are you going from here?
The next step will be using these data and providing them to people in the state as they talk about mental health disorders, and to think about, as we look at the data, family members. You know, 1 out of 4 people in our country struggles with a mental health disorder, and family members are aware of that. So how can we not only provide assistance to providers, but people struggling with mental health disorder and family members, so that they understand the importance of treatment, and there's hope in treatment, and that there's good evidence for the kinds of treatment that works, and we'll push that out as part of this effort.
Fascinating. So not as much stigma for mental health, but still pretty high stigma for substance abuse, you said?
We haven't done that survey yet.
We haven't.
I thought I heard you say that, okay.
Yeah, well, we see that nationally. And, you know, there's a real push to look at using language that's less stigmatizing. You know, when you say substance use disorder, that has a different message than addict. So how can we flip some of our thinking about these issues and understand that there's trauma in many people's background that influences how they approach their adult life. And so these things are complicated, and they're solved with working with professionals and researchers that understand how complicated it is.
Fascinating stuff. If people want more information, can they get a hold of you somehow?
Absolutely. We're at the university, And the Mental Health Technology Transfer Center and the Addiction Technology Transfer Center has resources that we serve throughout 6 state regions. So we're pleased to be in North Dakota talking about that today.
Well, thank you so much.
Yeah,
Thank
great
you for
work,
having
you
us.
guys.
Yeah.
All right, stay with us. Coming up on North Dakota Today. When is the right time to introduce your little one to solid foods? We'll hear from a Sanford expert next.